If you're watching this video, chances are you already know about the ring dinger and what it could do for you. You probably already know about the incredible adjustments and the happy patients. You probably already know about the immediate results and how easy it is to get the ring dinger done. All right, put it down. Good, rest your hands on your stomach. And let your hair all the way out.
Oh my God.
All right, let your hair all the way out. There we go. Now, if you're one of those people that are on the fence about the ring dinger, or looking to research it more, or just curious about a little bit about how it works, this video is for you, especially if you live in the New York area. Now, if you're in Texas or Houston, go see Dr. Johnson. He's the one that developed this table and this technique. I'm part of the team Ring Dinger Doctor, so I'm the only doctor in the Northeast, specifically New York State, New York City, that is allowed to do the ring dinger technique. So I'm just gonna go over some of the most common questions I get about the ring dinger technique. So why is it called the ring dinger? Well, Dr. Johnson, Dr. Gregory Johnson, he's a chiropractor with almost 40 years of experience, maybe more, in Texas. He developed this technique after years of doing it, and he named it, gave it a name, the ring dinger. You'd have to ask him why he named it that way. There's no ringing, but it's a super powerful adjustment. So what does it treat? And who is this for? Well, basically anyone that has a spine that is looking for results. This full body technique will decompress the entire low spine. So we've seen a lot of patients with sciatica, disc herniations, lower back pain, arm pain. We've seen a lot of patients that have seen other chiropractors, haven't had the results they wanted or expected, and then we do this technique and it's a life-changing adjustment. If you're watching my videos or watching other videos, it looks like people that get this treatment have really extreme problems or really bad issues. And my pain doesn't seem that bad. Is this okay for me to get done? Yes, it's fine to do it if you don't have an extreme problem. We do regular chiropractic care as well, but the ring dinger technique allows me to decompress and unload the entire spine. So just because you don't have a serious issue doesn't mean that you can't benefit from this excellent technique. That's the great thing about this treatment. You don't have to be in extreme pain or get dozens of treatments to see the relief. The relief is pretty much instantaneous. It's also affordable, and it's one of the best hands-on techniques that gets results and gets results fast. So the question we also get a lot is, do you really have to pull that hard? The answer is yes. For us to achieve a maximal neurological release that affects all of the motor units and get the results, we need Dr. Johnson trained us all to pull harder. We're not gonna hurt the person. Some of the comments you see in our YouTube videos, oh, you're gonna hurt that person. He's been doing this for close to 40 years. I've been a chiropractor for 26. Chiropractic is very, very safe. This technique is very, very safe. And we obviously screen our patients. So if there's a chance that it could be a problem, in the screening of the technique, we'll rule out certain people that obviously can't have this done. So anyone that's over 65, anyone that is on blood thinners or has had stroke or cardiovascular issues, is red flagged for this technique, but pretty much anyone with a spine that has arthritis, mild arthritis, could benefit from this technique. And of course, some people really, really love the super hard pull. And you don't have to be afraid, it's very safe, and now you know why and how it works. So how long does pain relief last? That depends on how long you've been in pain and how well you respond to treatment. And also how fast you heal as an individual. Most people will require several sessions. And I want to be very clear, we also go beyond and add other techniques to complement, like at-home care or soft tissue techniques that I utilize in my office, like the active release technique or the Grasslin technique, to address different components of the problem. So I say this in all my videos, we are after fixing the root cause of your problem, which almost always is spinal misalignment causing pain and dysfunction. We want to get you back to living your life. Well, there it is. I hope this video made you a little bit more comfortable about seeking the relief that you deserve with the ring dinger and or chiropractic technique. So these have been some of the most common questions I've gotten about the ring dinger technique. But if I missed something, please don't hesitate to reach out. I'm easily accessible on YouTube if you're watching this on YouTube, or Instagram at Dr. Shoshany, or by email, or if you're in the New York metropolitan area and you want to give us a ring, we're also doing phone consults, 212-645-8151 and drshoshany.com.